Welcome back to Clarity Education Systems and www.pmhnptesting.com. I'm Dr. John Rossi, and in this video, we will continue our discussion on neurotransmitters, specifically norepinephrine. Let's start with a quick review of neurotransmitters and recall that they are chemical substances produced within neurons that transmit signals across the synapse and whose neural functions range from basic reflexes to complex cognitive tasks. They are important in psychiatry because imbalances in neurotransmitters like serotonin, dopamine, norepinephrine, and GABA have been linked to various psychiatric conditions. Recall that many psychotropic medications like SSRIs, antipsychotics, and mood stabilizers work by modulating these neurotransmitter activities, either by affecting the release, the reuptake, or receptor binding. Understanding each neurotransmitter is extremely important, as you will see this information on your exam. You'll need to go beyond memorization and be able to apply this to actual scenarios and clinical management decisions. Our role is to understand fundamental mechanisms that underlie medications. Grasping the complex interplay of neurotransmitters arms us with the knowledge to make informed clinical decisions, educate our patients, and further the field of psychiatric medicine and nursing. Norepinephrine, also known as noradrenaline, is an organic compound that functions in the brain and the body as a hormone and neurotransmitter. So let's go over some of the essential points about norepinephrine. Norepinephrine is a catecholamine, which is a class of molecules that also includes dopamine and epinephrine, or adrenaline. It is synthesized from the amino acid tyrosine. In the central nervous system, norepinephrine is released from noradrenergic neurons and plays roles in alertness, attention, mood, and learning. In the peripheral nervous system, norepinephrine is released from the adrenal medulla into the bloodstream as a hormone, where it contributes to fight-or-flight response. This includes increased heart rate, increased blood flow to the muscles, and heightened senses. Norepinephrine is released from presynaptic nerve terminals into the synaptic cleft. It binds to and activates postsynaptic adrenergic receptors, leading to various physiological responses. Once its action is complete, norepinephrine is taken back up into the presynaptic terminal via the norepinephrine transporter. The effects of norepinephrine are mediated through its interaction with adrenergic receptors. These are classified mainly as alpha and beta receptors, with each having subtypes. Depending on which receptor is activated, norepinephrine can have a varied effect on the organ or tissue in question. Alpha-1, found primarily in smooth muscles of the blood vessels, the activation of these receptors generally results in vasoconstriction, narrowing of blood vessels. There are three subtypes of alpha-1: alpha-1 alpha, alpha-1 bravo, and alpha-1 delta. Next up, we have alpha-2, located both presynaptically on the nerve terminals where norepinephrine is released and postsynaptically on target cells. Activation of the presynaptic alpha-2 receptors inhibits the release of norepinephrine, acting as a feedback mechanism. In contrast, the activation of postsynaptic alpha-2 receptors can have varied effects depending on the tissue, such as vasoconstriction in some blood vessels. There are three main subtypes: alpha-2 alpha, alpha-2 bravo, and alpha-2 Charlie. Now on to beta. Beta-1, found mainly in the heart and kidneys. Activation of these receptors in the heart increases heart rate, or the chronotropic effect, and the strength of the heart muscle contraction, or the inotropic effect. Beta-2, located primarily in the lungs, arteries, uterus, and skeletal muscle. Activation generally leads to relaxation of smooth muscle, as seen in bronchodilation of the airways and vasodilation of certain blood vessels. It is the target of many asthma medications. Beta-3, found mainly in adipose or fat tissue. When it is activated, it leads to a breakdown of fat. Now, it is worth noting that while norepinephrine interacts with all these receptors, its affinity or strength of binding can vary. For instance, norepinephrine has a higher affinity for alpha receptors than epinephrine does, especially the alpha-1 subtype, leading to its pronounced vasoconstrictive effects. A deficiency in norepinephrine or imbalances in its levels can have several effects on the body and mind, giving the neurotransmitters critical roles in various psychological processes. Here are some of the potential consequences and associations of norepinephrine deficiency. One of the most well-recognized associations with low levels of norepinephrine is depression. Many antidepressant medications, such as selective serotonin and norepinephrine reuptake inhibitors, or SNRIs, work by increasing the levels of norepinephrine in the synaptic cleft along with serotonin. Some theories suggest that individuals with ADHD have imbalances or deficiencies in norepinephrine levels, contributing to symptoms like inattention and hyperactivity. Some ADHD medications boost norepinephrine levels in the brain to address these symptoms. Low levels of norepinephrine can result in reduced vasoconstriction. This can lead to orthostatic hypotension, a condition where a person's blood pressure drops upon standing, leading to dizziness or fainting. Given norepinephrine's role in attention and memory consolidation, a deficiency might contribute to problems with memory and learning. Low levels of norepinephrine can decrease overall alertness, leading to fatigue, lethargy, and lack of motivation. Norepinephrine is vital for the fight-or-flight response. A deficiency could lead to an inadequate or blunted response to stressful situations. Norepinephrine has a role in the modulation of pain. Low levels might lead to increased pain sensitivity or decreased pain tolerance. Given its role in the sleep-wake cycle, norepinephrine deficiency might contribute to sleep disorders or disturbances such as insomnia. An excess of norepinephrine in the body can lead to various physiological and psychological effects as well due to its central role in the fight-or-flight response, as well as other neural pathways. Here are some of the potential consequences and associations of norepinephrine excess. One of the primary effects of elevated norepinephrine levels is increased blood pressure. This is because norepinephrine causes vasoconstriction, or the narrowing of blood vessels. High levels of norepinephrine can stimulate the heart, leading to tachycardia or an abnormally rapid heart rate. Elevated levels of norepinephrine in the brain can be associated with increased anxiety, restlessness, or even panic attacks. An individual may experience heightened alertness, increased vigilance, and insomnia. Excessive norepinephrine can lead to physical symptoms such as shaking or tremors. Elevated levels of norepinephrine can cause exasperated headaches. Norepinephrine can stimulate the release of glucose from energy stores, leading to elevated blood sugar levels. An excess of norepinephrine can lead to dilated pupils and can also stimulate sweat production, which leads to excessive sweating. While low levels of norepinephrine are often associated with depression, excessively high levels can cause mood swings or even manic-like symptoms. While norepinephrine increases blood flow to the major muscle groups in the fight-or-flight response, it can reduce blood flow to less essential areas during emergencies, like the gastrointestinal tract, and this will lead to symptoms like nausea. A notable condition associated with excessive norepinephrine is pheochromocytoma. This is a rare tumor of the adrenal glands that produces an excessive amount of catecholamines. Symptoms include severe hypertension, sweating, headache, and rapid heartbeat. Several medications influence the levels, release, reuptake, or receptor interactions of norepinephrine that occur in the body. These drugs can increase or decrease norepinephrine levels or its effects. This is all depending on their mechanism of action. Here are some specific medications that can alter norepinephrine in the body and therefore result in increased or decreased levels. First up, we have selective norepinephrine reuptake inhibitors, or NRIs. Examples include atomoxetine or Strattera and reboxetine. They inhibit the reuptake of norepinephrine into presynaptic nerve terminals, increasing the amount of norepinephrine available at the synaptic cleft. Next up, we have serotonin norepinephrine reuptake inhibitors, or SNRIs. Examples include duloxetine or Cymbalta, venlafaxine, Effexor, and desvenlafaxine, Prestique. Now, these inhibit the reuptake of both serotonin and norepinephrine, therefore increasing their levels at that synaptic cleft. Tricyclic antidepressants, or TCAs. Examples include amitriptyline, Elavil, nortriptyline, Pamelor, and imipramine. They inhibit the reuptake of both norepinephrine and serotonin, though the specific affinity can vary among the different types of TCAs. Next up, we have an alpha-2 adrenergic antagonist. Examples include yohimbine and mirtazapine, also known as Remeron. The The mechanism of action for these drugs is to block the inhibitory alpha-2 adrenergic receptors. When these receptors are blocked, there is an increased release of norepinephrine. Next is a stimulant medication. Examples include methylphenidate, or Ritalin, or Concerta, and amphetamines such as Adderall and Vyvanse. Very specific mechanism of action. These increase the release of norepinephrine and dopamine and also inhibit their reuptake. Coming up next, we have what's known as a beta blocker. Examples include propranolol or Inderal, metoprolol or low-pressor Toprol XL. Mechanism of action for these drugs is to block the beta adrenergic receptors, reducing the effects of norepinephrine and epinephrine on these target tissues, particularly in the heart. Moving on to alpha blockers, examples of alpha blockers include prazosin or Minipres and terazosin. Mechanism of action for these drugs is to block the alpha-1 adrenergic receptors, therefore inhibiting the vasoconstrictive effects of norepinephrine. We often give these to help with nightmares. Monoamine oxidase inhibitors, or MAOIs. Examples include phenelzine, Nardil, and tranocyclamine parnate. MAOIs inhibit the enzyme monoamine oxidase, which breaks down norepinephrine, serotonin, and dopamine. This results in increased levels of these neurotransmitters. Finally, we're going to take a look at COMT inhibitors or COMT inhibitors. An example would be entacapone, which is used in Parkinson's disease. These inhibit the enzyme catechol-O-methyltransferase, or COMT, which breaks down catecholamines like dopamine and norepinephrine, therefore leading to their increased availability in the system. In summary, understanding the neurotransmitter norepinephrine is crucial for mental health providers for several reasons. First, it's the basis for various disorders. Imbalances in norepinephrine levels are implicated in numerous mental health conditions, including depression, anxiety disorders, ADHD, and more. As a result, understanding norepinephrine helps clinicians recognize and diagnose these disorders. Second is therapeutic interventions. Many pharmacological interventions in psychiatry target the norepinephrine system. For example, some antidepressants work by modulating norepinephrine levels or its signaling in the brain. Understanding how these drugs work at the neurotransmitter level allows clinicians to make more informed prescription choices and predict potential side effects. Number 3, side effects and drug interactions. Knowledge of norepinephrine and its effects is essential when considering potential drug interactions. Some medications might elevate norepinephrine excessively, leading to symptoms like hypertension or anxiety, while others may reduce its effects, potentially reducing the therapeutic efficacy of a prescribed medication. Patient education. Being well-versed in the role of norepinephrine allows clinicians to educate patients about the biological underpinnings of their conditions. This can demystify the disorder for the patient, reduce stigma, and enhance adherence. Biofeedback and therapy. Some therapeutic techniques, such as biofeedback or certain behavior interventions, might indirectly influence norepinephrine levels or the body's response to it. An understanding of norepinephrine can guide therapists in integrating these techniques. Holistic view of patient health. Norepinephrine is not just a neurotransmitter of the CNS, it's also a hormone in the peripheral nervous system, with roles in heart rate, blood pressure, and more. Understanding norepinephrine allows mental health providers to consider the broader health implications for a patient, particularly if they have coexisting medical conditions. Finally, psychophysiological insights. Recognizing the symptoms of altered norepinephrine levels, whether due to stress, medication, or other causes, can offer insights into a patient's state. For example, increased norepinephrine might be linked with heightened alertness, anxiety, or a fight-or-flight state, which can be important cues in therapy. Thanks for watching. Make sure to like and subscribe to view more videos in this series.